Hi, good evening. I am Dr. Rajiv Sharma. I am the head of cardiology department at the Cardinal Gracious Hospital in Vasai West. Today we are going to discuss about high blood pressure. What is high blood pressure? High blood pressure is when the force of the blood flowing in the blood vessels of the body is on the higher side. Usually blood pressure is recorded with an instrument called a sphygmomanometer. A sphygmomanometer is of various types, for example the mercury ones which are out of favor now due to the poisoning result, and also the oscillometric, the automatic ones which are available for our home use also. They are fairly accurate and offer the ease of convenience at your doorstep. Blood pressure is usually recorded by two readings. The above reading is called as the systolic blood pressure, and the normal range of systolic blood pressure is between 90 to 130 mm of mercury. Any reading above 130 mm of mercury is abnormal, and above 140 mm of mercury is an indication for treatment. The lower blood pressure is known as the diastolic blood pressure, and the normal range of diastolic blood pressure is between 60 to 80 millimeters of mercury. Any reading above 80 millimeters of mercury is abnormal, and any report above 90 is an indication for treatment. So normal blood pressure is written as the systolic over diastolic. So it will be written as, for example, 130 by 80. So any reading above 130 by 80 is abnormal, and any reading above 140 by 90 an indication for treatment. Why is blood pressure so important? Blood pressure is so important because blood pressure is almost responsible for 15% of the deaths occurring worldwide, and presence of a high blood pressure doubles the risk of a brain stroke, a heart attack, or a kidney related disease. Overall, blood pressure is known as the silent killer because when the end organs are damaged, it is only then that the patient starts experiencing symptoms. What are the organs that can be damaged by blood pressure? Blood pressure can affect the brain. Coming down, it can affect the eye. Coming down further, it can affect the heart, where it can cause a heart attack or it can cause a heart failure. Coming still lower down, blood pressure affects the kidneys, and it can affect all the blood vessels of the body. So blood pressure has to be periodically checked. Now, what can we do for blood pressure? Blood pressure is a lifestyle related disease, and with a good lifestyle we can control the blood pressure. Most important aspects of lifestyle will be adequate sleep, reducing mental stress, reducing the salt consumption. In our Indian diet, there is plenty of salt consumption which should be reduced to less than 5 grams of sodium chloride per day, which effectively means less than 2 grams of sodium per day. Also, we should encourage physical activity. So 30 minutes of physical activity of any kind like swimming, jogging, cycling, or a brisk walk where a person should have some sweating at least while walking is recommended. Also, patients should stay away from addictions which help in control of the blood pressure. Having said that, even after the lifestyle changes, if the blood pressure targets are not achieved, it is very important to take tablets, adhere to the treatment regimen, and follow your doctor on a regular basis. Thank you.